Sample Nurse Aide test questions. Let's get started. When taking a client's radial pulse, the nurse aide's fingertips should be placed on the client's. Is it A, chest? Or B, wrist? Could it be C, neck? Or lastly, D, elbow? The correct answer is B. Here is why. The radial pulse is specifically located on the inner wrist, along the thumb side. Option A, chest, is incorrect. That is the location for an apical pulse with a stethoscope. Option C, neck, is incorrect. That is the site for the carotid pulse. Option D, elbow, is incorrect. The brachial pulse is in the antecubital space, but the radial is at the wrist. Next question. The nurse aide reports directly to the. Is it A, nurse supervisor? Or B, physician? Could it be C, staff development nurse? Or lastly, D, administrator? The correct answer is A. Here is why. The chain of command has nurse aides under the direct supervision of a licensed nurse, RN/LPN. Option B, physician, is incorrect. Doctors give medical orders but do not directly supervise aides. Option C, staff development, is incorrect. These nurses provide education, not daily supervision. Option D, administrator, is incorrect. They manage the facility at an executive level. Next question. When communicating with the client's family, the nurse aide should. Is it A, listen to concerns and offer support? Or B, offer advice about the client's medical treatment? Could it be C, get involved in family problems? Or lastly, D, share the latest facility gossip? The correct answer is A. Here is why. Active listening and supportive communication build trust and a therapeutic relationship. Option B, offer advice, is incorrect. Medical advice is outside the aide's scope of practice. Option C, get involved, is incorrect. It is unprofessional to intervene in personal family dynamics. Option D, share gossip, is incorrect. It breaches confidentiality and damages professional credibility. Next question. The nurse aide is making an empty bed and notices that the side rail is broken. The nurse aide should. Is it A, wait for the next safety check to report the broken side rail? Or B, report the broken side rail immediately? Could it be C, tie the side rail in the raised position until it is fixed? Or lastly, D, warn the client to be careful when getting back into bed? The correct answer is B. Here is why. Immediate reporting ensures prompt repair and prevents potential client injury from faulty equipment. Option A, wait, is incorrect because it delays addressing a known safety hazard. Option C, tie it, is incorrect. Makeshift repairs are unsafe and unreliable. Option D, warn client, is incorrect. Warnings do not fix the hazard and place responsibility on the client. Next question. The nurse aide is caring for a client who becomes incontinent of urine right before dinner. The nurse aide should. Is it A, take the client to the dinner table and clean up after dinner? Or B, clean the client and take to dinner as soon as possible? Could it be C, tell the client not to eat until the client has cleaned and changed self? Or lastly, D, insist that the client eat dinner in the room? The correct answer is B. Here is why. This respects the client's dignity, ensures hygiene, and minimizes disruption to their routine. Option A, take soiled, is incorrect. It compromises dignity and hygiene in a public space. Option C, withhold food, is incorrect and punitive. It uses a basic need as leverage. Option D, insist eat alone, is incorrect and isolates the client unnecessarily. Next question. The nurse aide notices that the client's radio cord is draped across a chair in order to reach the nearest outlet. The first thing the nurse aide should do is it A, tell the client the radio is a safety hazard and take it away? Or B. Unplug the radio and ask the client not to use it. Could it be C? See if any changes can be made so that the radio can be plugged in safely. Or lastly D. Take the radio to the activities room and tell the client to listen to it there. The correct answer is C. Here is why. This addresses the tripping hazard while respecting the client's property and seeking a collaborative solution. Option A, take away, is incorrect. It is disrespectful and an overreaction before attempting a simple fix. Option B, unplug and forbid, is incorrect. It deprives the client without solving the problem. Option D, move to activities, is incorrect. It restricts the client's access and autonomy in their own room. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.